Recovery Task Force meeting to order. And I'm going to take a roll call. So please unmute and say here when I call your name. Jason?
Here.
Thank you. Mike?
Here.
Thank you. Nina?
Here.
Thanks. Pavel?
Here.
Great. Sakat Sun? I saw Trish is here. Can you test out your microphone for us, Trish? I just want to make sure you'll be able to.
Yeah.
Oh, perfect. Thank you. Janine? Not seeing Janine. Shashi?
Here.
Thank you, Shashi.
Thank you.
And Marisol and Berkey and Grace are all excused today. I didn't see Marlene here, but I'll call it out. Is Marlene here? Great. And Ron is here.
Here.
Thank you, Ron. And I also didn't see Stephanie here. Stephanie? Okay. But I just want to confirm with Joanne, we have a quorum to go ahead today. Thank you. So I'd also like to acknowledge that we have some staff participating in today's call as well. City Administrator Wally Bobkowitz is joining us. Executive Assistant Joanne Biscara is running the meeting for us. And we have our media production specialist, Tim Smith, who is recording and televising us. We also are going to be providing some updates today. We have Andrew Stevens and Glenn Huffman from Eastside Fire and Rescue, Jeff Watling from Parks and Community Services, Monica Negrilla from our Human Services Manager, and Jen Davis-Hayes, our Economic Development Manager. So our first item today is approval of the minutes. The minutes are from April 6, 2021. And are there, I should turn the chat on so I can actually see you all when you're talking. Okay. Is there any objections to approving the April 6 minutes as presented in the agenda packet? And if you just want to indicate that in the chat, that would be great. Make sure you change who you are sending it to in the to bar to all attendees if you're sending something to the chat. Not seeing any objections. The minutes are approved as presented. And Joanne, has anyone signed up for public comment today?
No, not today, Mayor Polly.
Thank you. So let's get into our agenda items. And the first is a community vaccine partnership update. And I see Andrew Stevens ran away, so he must really not want to give the update. And I'm not sure if Glenn is with you or not, but Andrew, take the floor.
Yeah, hi, thanks, Mayor. I do apologize. It is normally the witching hour when it comes to vaccines. It's our last half hour of appointments, and we're always doing that kind of dance between how many appointments, how many no-shows, and how many vaccines we need to draw. So we've made it through 5 weeks of appointments so far. Yeah, because you have extra spread. So we're adding extra people right now just to make sure we don't have any doses wasted. So this is actually theoretically our last week of first dose appointments. To date, we have done nearly 8,700 doses at our Lake Sammamish site through the partnership with the city of Issaquah and Sammamish and the Snoqualmie tribe. It's been a smashing success, at least in my opinion. I'm probably biased though. But when you're looking at where these demographics, where the patients are coming from, who we've served, it is from Issaquah, it is from Sammamish, it is from the greater Snoqualmie Valley, and we've not really pulled much populations from north and south and from Seattle and other aspects of King County. So I think it's extremely validating, and it shows that a site, a publicly run vaccine site that was not limited by the restrictions or confines of how King County Public Health determined how necessary that really was. And I think it further shows, if you look at the vaccination rates across King County communities, the cities of Sammamish and Issaquah are two of the highest populations for doses, everyone over 16 who has started their dose. I believe Issaquah is sitting And I can pull this up really quick. I apologize. You guys are sitting right now at over 81% vaccinated. I mean, that is unbelievable. Sammamish, and this actually, probably includes some portions of Issaquah as well, is 89% in the southern portion and 88% in the north. So it goes to say that your populations are respecting, the vaccination process. You are buying in your outreach campaigns, the support from the public officials and the community members and community leaders has been outstanding. And I think that's just gone and it's resonated with your populations. And you'll see that, before too long, you'll have a much greater sense of normalcy. As I'm sure you're aware, fewer and fewer restrictions are surrounding individuals who are fully vaccinated. They're 2 weeks past that second dose. So the job isn't over. We're going to continue at this site at least for another month, doing about another 8,000 booster shots. And we're going to continue to welcome people into the community. I'm going to open up more appointments for second dose only individuals. So I know there's populations that have received first doses in other locations and they're looking for that second dose, or now with these new restrictions, maybe they're more inclined to get that second dose. I guess the restrictions loosening. So we're going to open that up and see if we can get even more shots in people's arms. We've continued to do mobile pop-up clinics. We did another one, just a small clinic in Sahali today and got 30 individuals. We did one last Friday evening up in the Issaquah Highlands and got roughly 30 individuals as well. And we've opened up a few night clinics at the Lake Sammamish site. So we're trying new things, and it seems to be working. So the populations are getting vaccinated. We've reached a point really with saturation. And I'm sure you're aware, you have a lot of populations of 12 to, 15-year-olds that are now eligible through Pfizer. And we haven't fully committed to trying to do that simply because through the discussions I've had with public health and several of the other agencies, primarily also the Snoqualmie tribe, there are some limitations with Pfizer operationally, mainly being the cold storage requirements that the casino does not have, a dedicated deep freezer down to -60. But we're exploring options to see if we can, receive doses from possibly another tribe, a Tulalip, and just so we can get a portion of it, because they normally come in 900 patch doses. So we just want to confirm that if we do determine to try to do youth populations, adolescent populations, that we have that covered. And again, we're not wasting any doses. So the job is ongoing. Extremely happy with the work that Issaquah has done. Worked with the community service representations and the business community. They've tied us together with leaders from Issaquah Business and Chamber to provide coupons, and they're going to bring the McDonald's truck out here this Friday to, while the people are waiting in observation, we're going to get free chicken McNuggets. So it's just another small incentive to get folks out. Brenda Bromwell, Issaquah's emergency preparedness coordinator, has done an absolutely fantastic job of coordinating our volunteers out here from day one. We've never had a day where we didn't have enough volunteers, I believe. And now I'm just guessing, but as of last Friday, we were close to 2,000 volunteer hours at this site, and over 250 individual volunteers. So really proud with that. It's a huge burden off my shoulders. So thank you for Issaquah for supplying that as well.
Wow, that was just great. Andrew, you're so good at thanking everybody else, but you don't take enough credit for yourself. I mean, he's one of the big partners at the table. These regular Monday morning meetings we've been having for months have paid off. And what we thought was going to happen happened. There was a huge unmet demand here in this area of East King County. And so thank you for all that you're doing. Any comments on what is going on with Glenn's side, which is mobile?
Yes, so he has been standing up against the mobile pop-ups, which I did touch on as well. A lot of that is ramping down, and we are finishing up some of the second dose clinics that we did earlier in the last month. So he'll be continuing those efforts, those booster clinics this week and next. He's also working, I believe, with Monica and her crew to work with the Habitat or the Meals on Wheels populations for just another pop-up just to reach vulnerable populations, and this whole time we've really focused on equity and we've really focused on targeting BIPOC populations, and our numbers show it. Based on, if you looked at Issaquah and Sammamish's numbers by the books, both cities are predominantly white. However, the populations we've been able to serve through our efforts don't necessarily recognize that. We've done, countless, non-English speaking populations, several, you're looking at maybe just roughly 60% Caucasian, and the rest are coming from, Black and Indigenous persons of color. So the outreach is working. We've worked one-on-one with the human services staff to make sure that when we do target individuals who are having trouble, they're tying them in, they're getting them into our appointments, they're walking them through that system as well. So it's looking good. The mobile teams are going to start ramping down, but again, we're exploring options where if we can do smaller pop-up clinics with Pfizer with identified populations of youth, then we'll explore that opportunity as well.
That is really great. And I see Shashi has a question for you and Jason has a comment. So let's go to Shashi first.
Thank you, Madam Chair Polly. And thank you, Stephen. It's a very good update. And it's awesome that we have around 89% vaccinated. So what percentage is fully vaccinated with both the doses?
Yeah, actually, that's a great point. Let me pull that up real quick. It's obviously not as much because some people might have just got in a few weeks ago. And even though they're going to commit to that, if we're looking at completed the series for, 980229, which is the majority of Issaquah, that's 52% who are fully vaccinated, completed the series. So those numbers are only going to increase. I guess theoretically they're going to decrease because we just opened up another population pool from 12 and over. But with the buy-in you have, that is still most likely one of the higher population densities you've seen here. I think Mercer Island might have a higher, and maybe Shoreline. But besides that, Issaquah is doing a fantastic job. So I think a lot of the messaging this next couple of weeks is just returning for your second dose. And with us opening up new appointments for second dose individuals, we'll confirm that if you had Issaquah residents that had to drive to Olympia or Monroe or Yakima to get their first dose because we couldn't stand this site up when we wanted to originally, we'll take care of them here either way.
When do you think we will be able to have around 75 to 80% full, both the doses?
If I would say you're going to see that in the next 2 weeks.
Okay, thank you.
That's an assumption, but it could be up to 4.
Thank you.
Thank you, Shashi. And I'm not sure, Andrew, if you know, but these folks here have been invited to participate in some promotion. Autumn sent an email out about asking them to do a short video about why they got vaccinated. So we're going to keep working on the communication in multiple ways. If there are no more questions, I'm going to go to comments. We have at least 2 of our members who want to comment. First, Jason, and then Trish.
And thank you, Madam Mayor, and thank you, Mr. Stevens, for your tremendous effort, you and your colleagues out there doing wonderful work at our state park. So 2 things. I thought it was funny because you mentioned people that had to go to Monroe, and I got my first dose like early April, right when it was opened up to a certain segment, and it was amazing that within 2 to 3 weeks, it had opened up everywhere. People were now available to get whatever shot they wanted. Because when I got my first appointment, I had to go to Monroe. I got the shot that I got. So it's just amazing how quickly things are moving by people like yourself and the efforts of your colleagues. And again, that speaks volumes of what communities, when we work together, can do. This is just a comment, and I think this small panel of people is probably a perfect place to maybe mention this. Because I'd like to do, or I'd at least like to see maybe the Recovery Task Force do something like fly a banner over Front Street thanking Eastside Fire and Rescue for their tremendous efforts. I don't think a lot of our city knows exactly how involved they've been with this vaccine effort. And again, just saying thank you to our partners. I mean, again, not only the stand-up site at Lake Sammamish, but the vans, the mobile vans going to take care of our more at-risk population. So this is a perfect place. It's a small place where little suggestions like that we can make, and maybe just let more of the community know exactly who some of our heroes are. So thank you.
Really appreciate that, Jason. And it's Stevens with a V for that banner, right?
V for vaccine. Thank you for that comment, Jason. I'm hearing from multiple sources about how we're going to express our gratitude because the team has really, really stepped up and been impressive. Trish, you're next.
Yeah, can you hear me okay? Okay, well, on that banner, I want us to put the Snoqualmie tribe. I'm one of the Mary volunteers with Brenda out there, Andrew, and you don't recognize me because I don't have my mask on. But it's just to let everybody know, it's really a top-notch operation under Andrew and Brenda. They're really doing an excellent job. Everybody that's coming through is happy, ecstatic. The Snoqualmie tribe gives out goodie bags. So after you go through and get your shot, and then there's a mandatory, a minimum 15-minute waiting period, the Snoqualmie tribe has packed up goodie bags that we give to everybody sitting in their car. So, I mean, I've just been really, really impressed, and it's been a wonderful opportunity for me to participate in. So thank you, Andrew.
Lovely comment, Trish. Thank you. Keeping my eye on the chat, I'm not seeing any more questions or comments or, Pavel, would you like to make a comment, or was that just a thumbs up?
Yeah, no, just a comment.
Okay.
Well, I just want to echo everybody else. What a great job that Fire and Rescue doing. And just warn you, your job is not over. There's a lot of more people gonna come out, because I don't know if you guys are aware of or not, the CDC announced today that fully vaccinated people can drop the mask. A lot of time also indoors as well, as long as there's no populated, conditions. So there will be a lot of people that are a little bit hesitant about getting vaccine. I think they're gonna get in line with everybody else.
Thank you for bringing that up, Pavel, because I think under good of the order, since that press conference was at 2:30, I might see if State Administrator Bobkowitz will provide the group with some general oversights. There was a lot of positive information in that governor's press conference. I missed Ron. Ron, it sounds like you have a question, and then I'll come back to Jason for a comment.
So I'd like to second the motion that Jason said about the thank you banner. I think that's an awesome idea. So the question, this Commissioner Fall, for Andrew, is if a person gets the first shot and they miss the appointment for the second shot, how long do they have to go in between before the first shot becomes invalid? And do they have to
It definitely does help. You do want to get 2 vaccines before you're fully vaccinated, and the studies have shown that. You can delay that. You've seen it sometimes up to 42 days and without any issues really in the efficacy of the second vaccine. So if they are outside of that window, if someone just misses it for a day and they need to reschedule, we're really flexible to be able to get them into that same, maybe 4 days afterwards window, or even a few days before if required. But if someone is going on, it's better to get it again. And if they have any concerns, they can most definitely take that up with their primary care physician. But we've had a few individuals that, were 2 months out, spoke with their doctor, and the doctor said, yeah, absolutely, come in and get it. And we were able to take care of them.
Okay, thank you.
Thank you, Ron. And Jason, we're going to circle back to you, and then I think we might have gone through our list.
Okay, so one thing I forgot to mention my first time around was my dad actually went through you guys' site, and he also spoke very highly of you guys' professionalism and how wonderful it was. So while I went to Monroe, he was able to actually come to our site here in Issaquah. So I forgot to mention that. And again, spoke highly of how you guys operated. Real quickly, I thought of a question that probably a lot of people are asking is what happens if you lose your vaccination card, Mr. Stevens? How do people have to go to the point of origin? Because again, I know there's a way to get one back, but I have heard it's a little difficult. Can you maybe share?
Andrew, before you jump in, one of the things they did on the governor's press call was give out that email address. So I'm not sure if you have it or not, but what we can do is we'll find it and put it in the chat. So there is a way for you to get it produced from the state database. Do you have that, Andrew? Did you hear what that was yet? It's like
I don't have the web
something.
But yeah, all of our information is reported daily to the Washington, immunization records. Theoretically, if they got it here and lost it, we could look that up. What we have been doing most of the times, individuals may have left it at home. So we're reminding folks to bring their card in. We'll give them another card and we'll put their second dose sticker on that. And there's nothing saying they can't go home, find their card and just write that on, or just take them, put them both together, and that will serve purposes. But if they need a more of an official record, yes, what the mayor referenced, going directly to the state, all these records are there.
We'll get that link for you. It was the first time I heard about it today. The other recommendation that came out, Jason, was that everybody take a picture on their phone of their card, and that just based on the level of checking, a picture on your phone is probably going to be suitable. So, yeah. Well, there's a lot of information that came out of that governor's press conference today. Shashi, you have another comment?
Yes, I think I saw somewhere there's a link on CDC Gov website. If you lost your card, I think you just have to give your own information and you can print out from there. I think it is there. I heard about it. So not sure. I didn't check it out though. And they told us you keep it with your passport. So, and not to share any of this information on social media with anyone, because scammers are there trying to steal it.
Thank you, Shashi. We'll definitely make sure we get that information out. Well, Andrew, I want to thank you for coming today and all the good work you've been doing. And now you have to leave because we have to do some appreciation planning, and we don't want you to know what we're going to do. So,
absolute pleasure. Thank you so much, all. And thank you, Trish, for volunteering.
Oh, that was just great. The next item on our update list is Fit and Fun Outdoors, and Director Watling from Parks and Community Services is on the deck.
Great, Mayor Pauly, thank you. Good afternoon, everybody. It's been great coming back and updating you on some of this work. It's pretty clear that the city's parks and trails and athletic fields have really been playing a key role, have played a key role through the pandemic, but are certainly continuing to play a key role in recovery. The additional opportunities that we are trying to find and incorporate through Fit and Fun are progressing well. First, I'll touch base on two of the more project-based installations that are moving along and we should have completed here by the end of the month. First, the outdoor fitness equipment. I think when we last met and provided you an update, we had gotten approval from council to proceed with that. We were looking at options along the valley floor, in particular, close to and proximity to the Rainier Trail, to really make it accessible for as many residents as possible. Through work we did with our park operations team and others, we identified a location within Memorial Park, just to the east of the senior center. If you can imagine, and forgive me, I don't have a map, but near the depot building and near Rainier Trail, but on the other side of the senior center, there's a small pathway that carves under some trees. We're going to be installing 3 fitness stations along that path. So very, very accessible, great multi-generational location. Installation of that work will start next week. So we won't have to close any paths or trails as we do it. Really pretty simple, low-key installation that we're working with a local vendor, Northwest Playground, an Issaquah-based company, as we're purchasing the equipment from, so able to buy local. in this instance as well, which is always a great thing. With installation starting next week, we anticipate by Friday the 28th, which is the Friday before Memorial Day weekend, that equipment will be up and available for residents to enjoy and use. So exciting addition to Memorial Park and the number of amenities we already have in that park. Second installation project we've been working on is, if you recall, trying to add flexibility to tennis courts. We have a number of tennis courts throughout the city system. Tennis is a wonderful thing, and we don't want to detract from tennis, but if any of you follow pickleball, it is becoming quite the craze. So we've been working with our park operations team. We've identified 3 courts throughout our system. So one of our courts at Central Park, one of the courts at Tibbetts Valley Park, and one of our courts at Muirwood Park, which is in South Lake Sammamish community. So well dispersed, we're going to be installing or striping, if you will, two pickleball courts on one of the tennis courts at each of those locations. So that has actually been underway and should be completed by the end of this week. Exciting in that really simple installation, but we are now going to have 6 pickleball courts strewn throughout our system. We will, in the coming weeks, have some movable nets that will be installed at the location so that residents can push those nets off to the side if tennis players are playing, and are relatively, with wheels, easily movable for residents to put into place and enjoy pickleball. Before that time, though, and again, this is quite a thing. So if any of you are in the pickleball community, you know that BYON is kind of a thing. Bring your own net is kind of a known thing in pickleball circles. So I would imagine whether folks use these movable nets or bring their own nets, we encourage any and all pickleball use. We've also paid really close attention and been communicating with a number of our tennis groups in our tennis community, so that they understand and realize that the intent is to not detract or take away from tennis, but it really is just to encourage and foster multiple uses on these courts. So we look forward to that happening as well. A couple of program-based items that you may recall we've been working on are moving right along. Amy Dukes, our arts coordinator, has been working with a number of partners on a series of walk and learn opportunities, if you recall, utilizing some of our trails throughout town, and through storyboards and a number of things, just creating opportunities for families to get out and learn. Through the summer and actually into the fall, we're going to have a number of opportunities that we're going to be promoting. King County Library System is jumped on board. They're going to be doing a kid-focused learning, family learning opportunity that's going to be installed along the Rainier Trail down just across from Village Theater and sort of behind the Hailstone Shell Station. Historical Society is giving us some content that is going to be in a variety of other locations, again, like I said, through the summer and fall. We've also been working with a number of agencies, a big geocache event that's going to be happening throughout Issaquah that we'll be promoting, as well as some really fun scavenger hunt opportunities, everything from all the public art installations that are throughout town, encouraging people to get out and sort of explore the public art that's in town, as well as other opportunities. So lots going on, lots already going on through our Parks and Trails system, but I think just some fun ways that staff have really embraced opportunities to foster and create that much more outdoor use of our public spaces through COVID recovery.
Jeff, thank you very much. I think you forgot one thing. We do have the traveling dog park that was part of trying to give people, again, other opportunities to be outside. So what's happening with that? Where are you with that?
Yeah, thanks, Mayor. Yes, much going on. So yeah, our dog park tour is on its second site down at Squaw Valley Park. At the end of May and early June, it's going to move to its third tour stop, which is going to be right along the Rainier Trail at the community center where the old skate park used to be. Will become a fence just less than an acre dog park that'll run. That'll be the tour stop really through the summer months. A lot of good feedback from the community. It's been great seeing. I think Squaw Valley Park is being utilized in all new ways. I think some residents have discovered Squaw Valley Park maybe for the first time. The play area has gotten a ton of increased use as the dog park has moved to that site. Jennifer Fink and I were just talking about this morning. I think once the site moves to the skate park, probably late summer, we're going to send out a survey to the community to see how it's went as we begin to think of what year two's tour sites look like and what they will be. So great feedback we've received from the community. One last item, Mayor, that your dog park comment reminded me of summer concerts. As staff, we continue to plan. We're working with our partners at Kiwanis and other concert providers. We feel pretty confident. We're in position and have developed what will be very much look like a modified program. Right now, the numbers tell us we could host somewhere around 300 people. So we're positioning ourselves to maybe have to do a weekly registration type program, which isn't fun, but I think there's some ways that we can, through the work we've done, like with the farmers market, control ingress and egress and be able to provide a summer concert series this summer that might look and feel different, but I think would be very well received by the community.
Thank you, Director Watling. Your team has been enormously creative, and you have done a great job listening to this task force about where they thought we might be able to increase outdoor activity and health and wellness. So thank you for doing that. I'm going to look to the chat to see if there's any questions or comments. And Mike Brennan has both a comment and a question.
Yeah, first a comment to Jeff and your team. It's really been remarkable to watch how adaptable you've been through all of this and trying some new things. And it's, I think, been a great benefit to the community. So thanks for that. And thanks to your team. A question. So most of the things that you just mentioned, the picket ball and the kind of the exercise facility along the trail, kind of low capital cost to do that work. Is most of this going to be maintained long-term, or is this short-term investment now? And if it's long-term, some of this is still fairly staff-intensive. And the other second question is, how much of it can you handle through volunteers, like the nature walks and things like that, versus what is kind of adding additional demand on the city staff? And is that sustainable?
Yeah, great questions, Mike. I think in terms of what we've done project-wise, these are additional amenities that are not going to have a heavy maintenance lift to them. The fitness equipment, as you see that installed, looks and feels very much like small, play equipment. The pickleball striping, I think we've already gotten strong advocacy and support from the pickleball community. And I think as that community grows, I think there'll be interest in some volunteerism and opportunities to assist in any additional lift or maintenance work that we have. Great questions, Mike. Programmatically, I think as we move out of modified operations and things like our concerts, things like farmers market, I think we've already seen with the increase, much like the state park and the vaccination site, volunteers have been readily available and interested in helping out, whether it's the farmers market. And as we've already begun talking about concerts, we will definitely lean on volunteers to do that. And then hopefully as we get back to more of a normal operation post-COVID, we'll be at our typical historical staffing level. We'll be able to handle that.
It is a great question, Mike. I'm not seeing any other questions or comments in the chat at this time. But thank you for all of that, Jeff. Just a little plug for Jeff's team. They're also working on a program called Green Issaquah, where we develop volunteer forest stewards. And we've had an amazing start to it. I mean, I think the community wants more of these opportunities to participate in operating and running and maintaining and helping out. And so we're just super encouraged. And back to what Andrew had said about Brenda Bramwell and the CERT volunteers, they couldn't get their hands up fast enough. I think some who wanted to volunteer couldn't. So the community, the generosity of spirit has been a really beautiful thing to see during this very, very difficult time. It's been quite stellar. So thank you very much, Jeff. The next one on our agenda this evening, Jen Davis-Hayes, our Economic Development Manager, is joining us to give us an economic recovery update.
Hi, good afternoon, task force members and Mayor Pauley. So I'm going to start with a update about something that's not exactly related to the recovery, but I know that a lot of you may have seen in the news the fire that destroyed the Egg and Us and the Uptown Nails. And I want to let you know that we, the city, have reached out to the owners and have communicated with them if there's any business needs they have. When they're ready to kind of think about that. And I don't know if many of you know that the Egg and Us owners also own the 12th Avenue Cafe and have encouraged, so that's one way to help support that business, to go ahead and order some takeout or go there as well. So that aside, we have also been busy following up with some of the activities we talked about in the past. The last round of business grants, we provided grants to 51 businesses. That was the $250,000. We originally had 49 that we were going to provide, and one business did not need the grant, so we were able to fund 2 more businesses out of that. We also had LTAC funding to businesses and organizations that support tourism-related activities. We provided just under $50,000 for 8 projects, so you'll be seeing those.
Jen, can you tell them what LTAC is?
Oh, thank you. Lodging Tax Advisory Committee. And so that is the money that anybody who stays in a hotel in the city of Issaquah pays a separate tax that goes directly into our lodging fund, and it can only be used to help promote for activities that promote increased tourism. So, and we have a commission that oversees that money. And as part of their efforts for recovery was to, in the fall, provide $50,000 for grants to those organizations. And then again, did that again in the spring. So as Director Watling mentioned about the geocache event, that's one of the events that the organization, that funding supports. We just this week received the final contract for our Port of Seattle grant. They have an economic development partnership that provides every King County city $1 per capita to support economic development activities. Since we have the contract executed, we're now allowed to start spending that money, and a lot of that money will focus on recovery efforts, looking at providing business assistance support through this year. So that's the one-on-one advisors and classes for people to learn how to pivot, continue to pivot, enhance what they've pivoted with their businesses, as well as continuing our Issaquah Loyal Shop Local campaign, and really creating some digital media for our current, but also for our future marketing, so that as we are really gung-ho in our recovery and have opportunities to attract other businesses, we have some great media to be able to use for that. We continue to meet with what we call our vision partners. So that is our chamber, our Downtown Issaquah Association, the Issaquah Highlands Council, and Visit Issaquah and Gilman Village Merchants Association. For the last few meetings, we've invited in commercial property brokers to hear about how things are going on their property, what maybe some of the business needs are, and also how we compare to other areas, because a lot of these agents, work not just in Issaquah. And the good news is that it's not as bleak as maybe we may hear sometimes. Both agents from 2 properties have mentioned that our market is a lot stronger than in other areas, and that there are still some small businesses struggling, but a lot of businesses are catching up on their rent arrears, and really finding the way to kind of get back to a more normal. So it's not 100% yet, but that things are kind of moving in the right direction. So that's exciting to see now that we may be full blast pretty soon. And that also kind of gets to what I've been seeing as a staff person is we've had a lot more inquiries from businesses And a lot of them are saying, we've been wanting to get in Issaquah for years and we haven't found any sites. So they see, oh, this is a potential. And so that's probably, the little bit of the silver lining to if a business, one of our favorite businesses closes or has to downscale, that there may be an opportunity for a new business and some more diversity of our businesses to come into the city. So that's pretty exciting. We're also working with some of the things that you guys have worked on in the past, or suggested in the past, the downtown streetery. So we're working with the Downtown Issaquah Association. We are not, it's an event that this year will be completely planned and managed by DIA, but we're working with them to identify 4 weekends this year. And we are scaling back what was allowed in the previous years for multiple reasons, including, as anybody who's been on Front Street, you see the increased traffic, and the just making sure that the closure of that street does not negatively impact as many businesses as it positive, or more businesses that it positively impacts. And so we think we are coming to a decision with the Downtown Issaquah Association to figure out those dates. So more information ahead. And we are implementing the downtown streetscape, Alder Festival Street. We're going to be, we're out for bid for lighting to add lighting to festival lighting on either side of Front Street along Alder Street. So that's where the Subway and Lodge and Vino and Domino's are. And also we'll be working with the Arts Commission to create an asphalt mural path that will basically connect the sidewalk right by Subway. It kind of ends as you make the corner in Alder, and connect it back to the train depot park. And so again, trying to make that connection from downtown to our other assets in the area. So those are things that have been part of a plan that was adopted in 2017. And at the end of last year, the City Council allocated some money to get those things moving. I also want to talk about regionally some of the work we're doing with our East Side cities. I mentioned commercial lease arrears. We're actually doing a survey with the East Side cities. They're doing surveys of commercial property owners and managers and tenants to kind of get a better idea of how many, while we have heard from, one commercial property owner that lease arrears are not a huge problem. We're trying to get a better idea of what that impact is, or what that potential problem is more regionally, and if there are some programs we need to address, to put in place to address that. The East Side cities also have come together it was created a One East Side organization, and really that kind of started last year with so many different cities trying to provide the same thing. So they really focused on providing webinars around a lot of the topics that businesses needed. And they received an Economic Development Administration, so that's a federal economic development organization, grant to start a new business assistance program. So nonprofits and businesses can get 2 free hours of CPA consultation for accounting, or a marketing advice, or any kind of general business assistance. So again, trying to continue to offer those services for our small businesses so they can continue to make this recovery and take advantage of the new opportunities they see. And then both myself and my colleague, Benton Koblenz, who's Economic Development Coordinator at the city, have been participating in work groups for the regional recovery plan that is being put in place for not only King County, but also looking at parts of Pierce and Snohomish, and thinking about, again, when we recover, we don't want to go back to the same thing. We want to come back stronger and better. And how do we address some of the inequities that exist in our community? So that's a quick overview. And I'm sure the mayor will remind me if I forgot anything, because I'm sure there's some other things.
No, that was awesome, Jen. I think what you and Benton have done in pointing businesses towards resources and connecting them has been just so enormously helpful. And now with federal relief and state relief showing up in many different places, it's going to be even more confusing for business owners. So thank you. I'm not seeing any comments or questions at this time, but thank you for coming. And we're going to move on to our next presentation, which is a human services update. And our human services manager, Monica, is going to provide that update. Thanks, Monica.
Thank you, Mayor Polly, and good afternoon, Recovery Task Force members. It's great to be here. I'm going to provide a few updates from human services that are recovery oriented updates. And so I'm going to start with a few highlights from our work since our last update. As you heard earlier in the presentation, we heard from our wonderful staff at Eastside Fire Rescue. And so our team has been working closely with Andrew and Glenn and his team in providing support to both the mobile vaccination team and the drive-through vaccination site by engaging with our nonprofit partners who work with those who are most vulnerable, from senior community members to community members who are homeless and so forth. We also had our internal team at the senior center work and provide support on that as well. We also conducted outreach to community members who might have language barriers or technology-related barriers to accessing the vaccination scheduling system. So our staff was able to help really a few hundred people just schedule a vaccine. And so while in the big scheme of things that might seem small, but I think for us, definitely this was a huge gain, especially since we know that without that assistance, many folks would have not been able to schedule a vaccine and go through the drive-through site or benefit from the mobile team vaccination. So that was one of the areas in which we've been supporting our recovery efforts. In addition, also human services, for human services, we increased some staffing capacity to help support the recovery efforts, but also the long-term human services needs in the city. We recently hired the behavioral health coordinator to support the work of the police department in responding to crisis situations that involve a behavioral health component. And we also hired the human services coordinator to help administer the human services grants that the city provides to our local and regional nonprofit partners. And so next, in terms of some of the current work that we are conducting, similarly with our economic development team, we are also working with our nonprofit partners and helping them connect and promote the existing and the upcoming resources for our community members, from renter assistance for tenants and landlords to mediation services, utility assistance, cash benefits, anything that's available now and it's upcoming. We are trying really diligently to educate ourselves and really push out the information to our nonprofit partners and the community at large when applicable. We are also working both locally and part of the Northeast Funders regional team. We are working on assessing the needs of our community as we are entering in a different phase in the COVID response. And so in hearing and meeting with our nonprofit partners, I want to highlight a concerning trend that we are noticing across all sectors, whether that's food and basic needs providers or housing and shelter agencies, behavioral health organizations, really across all sectors. We see the growing lack of personnel for both specialized and non-specialized work. This has been a concern pre-COVID. However, it really has deepened and significantly worsened during COVID, especially as agencies had to provide more face-to-face services with less resources. So similarly with our hospital and fire rescue teams, often the nonprofit providers were out there providing services, providing food services and basic needs, providing shelter services, being there, providing mental health services. And so really this has caused a high staff burnout and a high staff turnover in all the nonprofit agencies. Really, they have a lot of difficulties filling open positions because they have lack of qualified candidates or lack of candidates, period. Some of the reasons that we identified for this could be the nature of work, because it's a lot of direct contact with high-risk populations, and they that involves in-person meetings where most of the world can work from home. these services need to be provided in person. There's also, and this has been a growing concern over the last several years now, a large discrepancy between nonprofit pay and for-profit payment structures. Often highly skilled position in nonprofit is paid at the same level with an entry-level position at the for-profit. So that is, and then just the lack of enough trained personnel is also a growing concern, especially as the mental health needs of the population in general increases and the enough trained personnel decreases. It is a systemic concern that we are noticing. And at this point, we don't have many options at hand, but we are trying to problem solve both locally and regionally. And so that takes us to kind of like in upcoming and future work. We want to continue to really assess the community needs as they evolve and continue to increase. And then hopefully later this year, our team is planning on working on a human services strategic plan to help guide the work in human services for the next 3 to 5 years. And so I'm going to stop here. These were kind of like the highlights for the recovery-oriented work that we've been doing, and we are available for questions.
That is great. Thank you. It's really cute when Monica talks about their teams, because it's usually a team of one or a team of two. You know, these are the mighty workers who do so much. And so, Jason, you look like you have a question.
Thank you, Mayor Polly, and thank you, Ms. Negrilla. So I guess the one thing I wanted to ask, and I think there's a brain drain, unfortunately, going on across most industries right now. I know that it's been in the news, so a problem kind of with some of the benefits for people to stay home a little longer. I know for just my own personal experience, we have hit a drought where I cannot literally hire someone if my life depended on it. So I've been trying. So I think it's industry-wide, whatever industry you're in, hiring people. But it is very unfortunate to hear, because I do, like you said, if you were to put it in a graph, the needs are going up as people start coming out of the pandemic with the resources coming down. I'm just wondering, and again, you might not know this, Ms. Negrilla, but are people trying to consolidate some of these NGOs instead of competing, doing the same or pretty much legitimately the same type of work? Is there any conversations with some of these people trying to pool resources? Because again, I know there's a lot of NGOs out there that do wonderful work, but they almost do it identically. And I'm just wondering if that conversation's even being had amongst those type of people. Is anybody thinking of that? Thanks.
Thank you. And yes, I think you're absolutely right. There is a need to look at creative solutions. And I know some of the conversations are happening, and some I think still need to happen. And I think there is a need to keep bringing ideas and suggestions to our nonprofit partners. There are times when they do merge, and especially in the behavioral health, I know of situations and cases where agencies did merge. And then there are others that I think there are still opportunities out there for sure. So thank you for that. Definitely, I think it's a great suggestion that we would love to continue to push forward to our community partners as a possible opportunity.
That's a really great question, Jason, just to take what Monica had said and give a little more context. At the mayor's level, we talk about what different things we can now do together. So whereas we most may have identified a need in our community and gone off and tried to resource it ourselves, we're looking at leveraging, and we're looking at sharing positions. And I think you'll hear a little bit more about this when City Administrator Bobkowitz talks about. We know there's a lot of money out there right now. It's hard to find, and it's hard to find people to deliver the services that Monica is talking about. So yes, we are talking about doing things differently coming back. And we also had expected that the need in the social services was going to continue to rise as we come out of the pandemic, because so many of the governor's emergency orders and other items that are in place are sort of sheltering people right now. So we haven't really navigated, and we don't really have a playbook for how to come out of this. So yeah, it's going to stay busy for sure. We have a couple more here. Let's go to Shashi for a comment, and then Jen, I think you just emailed me, but put something else in the text if you actually want to make another comment. So Shashi, let's go to you.
Thank you, Madam Mayor Polly and Monica. Great update, and I thank you so much. You're doing a great job. I think it's very, very difficult to do human service. That's the greatest service of all, I think. And thank you so much for helping people with language barrier and technology barrier. That's the biggest hurdle a lot of people face. I'm wondering, why is the salary so less that people don't want to join, and you have lack of staff? Maybe something should be done, because doctors, nurses, and healthcare, even medical assistants, they all are coming face to face with the patient, and I think they get good salaries. Then why not here? So I wish something can be done to improve, because that class of society should not sustain, should not be there for a long time. We have to bring them out. The homeless people should become independent and come out of homelessness. So we all look forward to that, though that's not easy to do. I worked for 5 years, volunteer work way back in, trying to, we were giving transitional housing to the homeless people. And I know I had a little apprehension coming face to face with certain things, not diseases, but something else. I had some other fears. But if payment is given and it's good, I'm sure you'll get people to work for you.
Yeah.
Thank you.
Thank you,
Thank you
Shashi.
for the services. Thank you, ma'am.
And Jen Davies-Hayes has a comment for the group.
Yes, thank you for letting me jump back in, Mayor Polly. So as Monica was talking about jobs and others, it did remind me that we will be doing a jobs fair, probably another virtual or maybe in-person one in the fall with our East Side cities. But one of the challenges, as you mentioned, is that there's maybe not people out there that are, willing to apply for these jobs or have other opportunities. And so the other thing that we have done with our East Side cities is to create pathways and have a navigator to help people who may have been laid off in one industry, so the hospitality or restaurant industry, and get retraining in healthcare and other high need areas. So it's not the silver bullet, but we are trying to think about how can we, help those who are working in our community that may want to change or have to change, have the opportunity to go into those other areas. So it's workforce is for businesses always an issue. It was before the pandemic, and it continues to be. And I just wanted to share that information. Thanks.
Thank you very much, Jen, for adding on to that. We're going to go to our next topic, which is federal relief funding update. And City Administrator Wally Balkowitz is going to be talking about that. And Wally, I'm not sure if you had a chance to see much of what the governor had said in his announcement or not, but if you had any items to share on that too, it'd be great.
Sure, Madam Mayor, members of the task force, good afternoon. Let me start with that last piece. Governor Inslee had a press conference earlier today and basically announced that all existing COVID restrictions for businesses and operations of all sorts will be eased on June 30th. So that is big news, good news. I think it's, I'll speak for myself. That's a lot to take in. Think, oh my gosh, June 30th is right around the corner. But a lot of the progress has been made, as you've heard today from our various speakers. So that reopening will occur on June 30th. It will happen even sooner if 70% or more of state residents over the age of 16 have gotten at least their first shot before then. And I guess currently the number is 57% of Washingtonians 16 and up have gotten at least one shot. So that is big news. The other big news today started in Washington with the Centers for Disease Control and Prevention relaxing guidelines for the wearing of masks for those that are fully vaccinated. And the governor also announced that the state of Washington would be adopting those guidelines as well. And will also ease restrictions for groups of fully vaccinated people. And the examples the governor gave were events like outdoor and indoor sports, won't have capacity limits for the number of attendees who have been vaccinated. In addition, weddings and funerals will be allowed at full capacity if the attendees have all been vaccinated. So that's all good news. Like I said, this idea that June 30 now is a magic date that things go back. I can't even say the words, go back to normal. But something that we're following very carefully here in the city of Issaquah. Our offices are still closed, but we have been tracking for some time a reopening date. We've said early July. I think, of course, that's always been code in our mind for July 5th. We're going to see if that's able to happen or not. One of the challenges we have is somewhat unrelated to the pandemic, and that is our intention not to reopen our City Hall Northwest, the facility next door to the currently closed Holiday Inn. So with that, we're planning on reopening only one main city office, one general government office here on Sunset Way, and that would be for both of our general government as well as our community planning and development staff. So that is still in the works, and we continue to plan to, if not the 5th of July, shortly thereafter, and I think that, again, is tracking with what the governor's announced today. As Jeff Watling mentioned, we're looking at recalibrating some of our summer events. We had not planned to do a downtown 4th of July parade or any kind of subsidiary activities. I think the council is still considering if it wants to do a drive around the community 4th of July event. So that's something I think we'll be announcing here in the next few days. So, Madam Mayor, members of the task force, unless there's some specific questions about those new general announcements and how those would impact Issaquah, I'm happy to move on to the American Recovery Act information.
Wally, I think you're good to go. I'm not seeing any comments right now, but people may chime in later. So thank you.
All right. Well, let me share my screen. Sure, I'm sharing the right PowerPoint. Hopefully everyone can see that.
We can see it. Yeah, there you go. Perfect.
Great. The American Rescue Plan Act, since last we've met, the acronym has taken hold. 30 days ago, it wasn't there, but it is today, ARPA. As we talked about at the last meeting and the meeting that we had with the City Council, recover, rebuild, and reimagine. Mayor Pauly really has seen those as the three watchwords as we move forward with the spending of federal dollars coming not only to Issaquah, but to communities all over America. If you remember, $350 billion split between states, tribes, territories, counties, and other local governments, 65.1 billion of that to local governments, municipalities, and approximately $8.6 million for the city of Issaquah. And remember that $8.6 million number, because that is a big part of the update as we're talking today. The timing of the funding, we've been waiting for the U.S. Treasury Department to enact regulations. So they had until May 11th to do that. They did that a few days ago, and communities all over America are pouring through that. As I think we've talked about before, the cities of the U.S. are divided really into two buckets. What are known as entitlement communities and others known as non-entitlement communities. Mostly bigger cities versus smaller cities. It's a little bit more complicated than that, but Issaquah is a non-entitlement community. And so now the state of Washington will have 30 days after the 60 days, so until the middle of June, to announce their plans to distribute funds. So at this point, the state of Washington has not done that. The federal government has for entitlement communities, and we'll talk a little bit more about that in a minute. The recovery funds remain available through the end of 24. The eligible uses for the recovery funding to respond to the public health emergency or its negative economic impacts, to respond to workers performing essential work, for providing premium pay, for the provision of government services to the extent of the reduction of revenue, do the COVID emergency, collected so to recoup that money, and then to make necessary investments in water, sewer, and broadband infrastructure. Can't do a few things, and again, this is all being clarified, can't deposit money into any pension fund. So none of those issues likely impact Issaquah. And as Mayor Pauley shared with this group and with the City Council a few weeks back, she really was looking for guiding principles as to how the money would be spent, and really looking at the strategic plan. We are at the 2-year anniversary of the strategic plan, and during the month of June, Mayor Pauley will be sharing a lot of information about the successes of the strategic plan despite the pandemic in the last year, and also ask the City Council to kind of relook and make sure that those areas still continue to make sense. And I know you have all seen this before, but the guiding principles of the strategic plan, people, environment, community prosperity, service excellence, and equity, really are meant to be guiding principles with how we spend the money. The goals of the strategic plan, I know you're also familiar with, and I think the idea is to be as supportive of the goals of the strategic plan as possible with these federal dollars. On April 6th, we had a community conversation that many of you were a part of to get your feedback on that, and just to briefly review what the top recommendations were to promote outdoor events. And as you heard from Director Watling, we're doing a lot of that right now, to think about our kids, to market Issaquah. And as you've heard, we're hearing a lot from people about wanting to be here in Issaquah. Another piece of information that will be coming out next month is the results of our community survey. We've had over 600 Issaquah residents participate in our once every 2-year community survey, and the results will be fresh off the press next month, and we'll be able to share those with the community. And I think, having seen a sneak preview of some of those results, I can tell you lots of positive information. People are very excited about being here, want to remain here, and I think the ability to entice newcomers as people are coming out of the pandemic is going to be very strong. Infrastructure was also a piece, and the City Council has spent much of the last month talking about the capital improvement plan for the next 6 years. And so clearly, I think there'll be opportunities to spend the money on infrastructure. A collaboration with other entities to leverage funds. I'll talk a little bit more about that in a minute. Talked about nutrition, replenish the city reserves funds, again, infrastructure, jobs, and then look at what we can do to replenish city staffing levels. So we've had this feedback, we've had these discussions. The federal government made funding allocations available. Again, if you remember, there are entitlement versus non-entitlement cities this week. The numbers that some of the entitlement cities have received are not in conformance with the numbers that we have seen that from the national local government associations. And so I think all of us in local government around America have taken a deep breath to say, oh my goodness, what does this mean? And in the last several days, we don't know what this means. And so while we have a plan to come back to the City Council on Monday, June the 7th, with some proposed spending, that plan a date may move just because we're not sure what that dollar amount is. We will not know until the state of Washington makes an allocation, but certainly with the news that some communities heard from Washington, D.C. this week, I think it's premature today really to talk more about how we might spend those dollars, because if they were to change dramatically for whatever reason, we would not want to overcommit. I think one of the things Mayor Pauley has done throughout this pandemic has been very thoughtful about only committing what we can do and not committing beyond that. And so really, until we know what that dollar amount is from the state of Washington to be passed through, we're not going to want to commit to that. But in the meantime, we do continue to talk to our neighbor communities. Many of those communities are still in the first stages of thinking about how this money would be spent. One topic that has gained some traction in some of our neighbor communities is devoting staff resources to a community navigator, someone that would help businesses, help individuals access funds that are available not from the city of Issaquah through the ARPA, but from King County, the state of Washington, and the federal government directly. So that may be something that we propose. But again, until we get a firm number from the state of Washington, given some of the surprises that some of our larger neighbor cities have seen, the recommendation of the administration is going to be to kind of hold. In the meantime, we've done a lot of things, as you've heard today. Very excited about the changes. I think really beyond the ARPA spending, the other real focus that we have is continuing to make sure people are vaccinated. Lots of folks are already vaccinated in the community. We want to get that number as close to 100% as possible. So that is something we'll continue to do, but we'll have an update to the council on the 7th. We plan to have this group meet on June 10th, and that will probably be the last meeting for the summer. And Mayor Paula, you may wish to talk about this before we depart today, about plans for the next few months for this group. But clearly we're moving into this firm recovery stage. Certainly something we were never quite sure when we would see, but I think every indication over the last, just the announcements today, it would indicate that that recovery phase is likely finally here. So again, to remind the task force of the mayor's the overarching goals: recover, rebuild, reimagine. The rebuild, reimagine piece really is going to depend on the money. If it is $8.6 million, I think we will have time to make those investments. I think it will be important. I know the mayor believes it will be important to make sure that we're not too far ahead of our neighbors. We want to be with our neighbors to see if there are synergies between the county, other local jurisdictions with that. So we may not see a lot of the money spent in 2021, but again, in order to make those investments to recover, rebuild, and reimagine, we've got until the end of 24 to do that. So this will be a longer process as well. So Madam Mayor, members of the task force, happy to answer any questions and any discussion that you all may have.
That is great. Thank you, City Administrator Bobkowitz. Yeah, and we will spend a little time after talking about meeting frequency. This group was originally formed with helping me to develop the recovery plan, and now 15 months in, we're getting there. That's really great. But as Jason had said before, once our work is done, then we're done, and that would be a sad day too. So we have a couple of folks with comments and questions. Let's start first with Jason.
Thank you. Thank you, Mayor Pauli, and thank you, Administrator Bobkowitz. So that was a lot of positive news in a very short amount of time. I appreciate it because I did not have the chance to see the governor's address. So I'm happy to hear it. I'm real happy to hear it. I think it's very wise of not only the city staff, I think it's very wise of the mayor to not spend the money till it's in the bank. The government giveth and the government can taketh. So I think that's a very wise move. And I like what Administrator Bobkowitz had mentioned about possibly getting a general navigator. And it's not because we're in competition with our lovely cities to the north, east, south, and west. But you better believe they're probably going to do something like that too, to see where funds are going, what funds can be coming from the county, from the state, from the feds. So of all the positions that possibly, if we're still just thinking outside the box of creative ways to use some of this money, utilizing it probably to have someone be able to be a private eye, be an investigator, and make sure that Issaquah is taking advantage of possibly getting monies from different localities or different municipalities. I think that's appropriate. Don't really want to leave money on the table that other cities that are bigger, broader, more assets and resources simply take the food off our table. So I typically think that's actually a great idea, is being part of it. The only other thing I would say is, I think my hope is that this coming decade is going to look like a lot like the 1920s, the roaring 20s. People are going to want to be outside. I even heard a gamer saying that the next 10 years for their industry is going to be horrible because nobody wants to be inside anymore. So I think the parks, Mr. Watling, all of these things are great ideas for us to look at and to invest in. Everybody knows that the outdoors is great for mental health. So a lot of wonderful things we can do with our parks. And then finally, I just wanted to say I was devastated to hear that the Egg and Us burned down. That's one of my main spots for eating breakfast pre-pandemic was always the Egg and Us, even when it was Julia's. waiting in line for 30, 45 minutes to get my eggs Benedict. So I'm very sorry to hear that. And I did not know that they were also owners of the 12th Avenue Cafe. So I'm glad somebody mentioned that. So hopefully we can help them out. But very, very sorry to hear that news. Otherwise, that was all I had to say.
Thank you, Jason. Shashi, you have a comment for everybody.
Yeah, thank you. And thank you, Wally. You have given very good update. I have few comments about reopening and all, considering our community health. Number one is that there will be some breakthrough infections. That means, say, around 5% of the population who has taken Moderna or Pfizer is not going to be fully immunized. So they might come up with some new variants and infection. Actually, if the Indian variant is here in Issaquah, that is too bad. I don't see it yet, but I don't know if it is there and not yet noted. So we have around 5 variants of concern and 8 variants of interest. So we don't know what's going to happen. In case that effectiveness of the vaccine is around 94, 95%, we are going to have around 2,000 people who might get COVID in our whole population of only Issaquah I'm talking about, in case we consider 40,000 as the population. So I think even if now I'm signed up for receiving emails from our governor, and it says that we are going to move to phase 3 of the Healthy Washington Roadmap to Recovery reopening plan effective May 18th until June 30th. That's only in 5 days. I'm a little bit worried if we are opening too early, because we have done it a few times and again, it's been bad. We are not fully vaccinated, only around 52% fully vaccinated still has some percentage where it's not going to be effective at all for them. I don't know my own status, even if I've taken 2 doses. So I think we need to be a little bit cautious. At least personally, people should be cautious. When our IHME, the Institute for Health Metrics and Evaluation, tells our governor that, okay, this is the threshold point, so we can open to this phase, and we have a healthcare system to take care of any patient that comes. That means those people who are on the front lines, if they get COVID by chance, we have ICU beds, we have oxygen ventilators, everything. It doesn't apply to personally to every household, because I think that piece of message is missing for laymen. And they think, okay, it's open, let's go out. And it's not for us, it's for them. That let's keep those beds and all that for that. Otherwise, we should look into the eyes of our loved ones and ourselves into the mirror and ask the question, who wants to be on that bed? And because I have just calculated the percentages, around out of 10 people who are hospitalized in Issaquah, 6 to 7 do not come home. They die. So keeping that in mind, I think for individuals like us, the common people, they should not let their guard go down at this stage, even if they're saying open. I went to Costco today. I had to bring my battery. I was double masked, even if I'm vaccinated fully, and I was very careful, but I took a chance anyway. Hope nothing will happen. Then I use the nasal spray as soon as I come home and wash, and all those precautions I'm taking. So I think for general public, we have to give them the message to be still careful until the pandemic is over. And if we want to use our freedom, it should be very, very cautious. So that's my comment from me. And what else? Yeah, breakthrough I've already spoken about. Yeah. Okay, that's it. Thank you so much.
Thank you, Shashi. And I'm just going to see if Joanne is able to send out that video clip from TVW as well, so that you can hear the governor's comments. Like, you don't have to go search for it yourself, and the Q&A after. I think it does come with that personal responsibility message that you're hoping for as well. Is we're not all going to go out and have a big party, that's for sure. We're opening in stages, but we will be able to, and especially if you're vaccinated, enjoy more things than those that are not vaccinated. So if Joanne can find and send out that link, that would be great. Or maybe come an email later. And it looks like Mike Brennan would also like to make a comment.
Yeah, I'll keep it short. Thank you, Mayor Polly. And City Administrator Bobkowitz, a lot of information there about kind of looking ahead. So I agree with Jason's comment about this notion of the navigator. And we heard from Jen Davis Hayes, that for businesses too, looking for opportunities to support them and their kind of navigating to opportunities to kind of recover from the pandemic as well. But the idea of kind of like businesses use and governments use grant coordinators to make sure their eyes are out there looking for those opportunities for additional fundings. They pay for themselves many times over. So that idea, when you do that at this level and maybe as a multi-jurisdiction commitment, I think makes a lot of sense to me and could capture some significant money that you may not otherwise find. On the kind of the recovery, build, reimagine, and hopefully the money actually really does arrive as anticipated. But hopefully, and I don't know what the list looks like under each of those as far as what the administration is thinking about, but hoping that the reimagine part doesn't get lost no matter what happens. Also heard, again in the economic kind of update about, new businesses coming into the city that, were looking previously, but now are finding, vacant storefronts where they can actually come in and open up, creating new opportunities for diversity in kind of the businesses and employment opportunities, et cetera. And so the reimagine, the looking ahead is always, I think, an important thing to not live in the moment. Because if you do, sometimes you do miss those opportunities that can kind of reset direction, create new opportunities, new economic value for the city too. So I just always, like the idea of kind of the future focus and making sure that we continue to look that way, look ahead for those things that could become the next big thing for Issaquah. So anyway, that's just a couple quick comments on your report. I appreciate the information.
Oh, Mike, that was great. And I see Joanne has put a link to the press release and she's still looking for the video, but I would recommend everybody watch it. I think it was like 15 to 20 minutes, but it was packed full of information. So Wally, I'm not seeing any other questions. Thank you for your presentation on the federal relief funding update. And now she's got the link in there for the TBW as well. She's really fast. We'll work our way now into other business and announcements. And as Wally had said, we're going to talk about future meetings and frequency of future meetings. I think most mayors and city staff are well aware that the funding is on its way, but we really don't know. We don't have as much, I don't want to say confidence, but surety around what exactly the funding number will be and what it will be used for. So City Administrator Bob Quitz and I have been talking about spacing out our meetings a little bit more. And we had talked about this earlier with our team as well. We don't want to keep bringing you back here if we haven't got some active things for you to put input into. And so we're proposing the next meeting be June 10th. And then Wally, through the summer, what was the expectation for this group?
Madam Mayor, members of the task force, I think our thought was we would keep you posted on significant developments, perhaps bring everyone back together then in September, and then take a sense of where we're at that point. So one more meeting prior to a recess in July and August, and then come back in September.
Okay, and I really like that. For those, we have one former council member on here. There is a cycle that the council goes through of planning for the operating budget. And while the staff is working on it through the summer, it really gets into the hands of council in early fall. And the ARPA money and the budget may become something that is discussed together in terms of some of the buckets of money would be paying for some of the same kinds of projects. So it's very likely that those two conversations will get commingled. The council starts around the end of September, beginning of October, and has maybe 2, 3, 4 sessions where they talk about it. Maybe we have an extra one this year because there might be an extra $8.6 million to discuss as well. And they make a recommendation and approval of the budget typically around Thanksgiving. Worst case scenario, it goes into that first meeting in December. So that's sort of where they're going to be with their funding discussions. And I'm hoping, we come back to you and we have more surety around what these recovery numbers are and have some more questions to ask you guys to think about. So any questions on our schedule? Well, then I'm just going to close this out tonight again by saying thank you. I'm giving you 2 minutes of your life back on a Thursday night. You have been an extremely valuable resource to my city team and myself as we navigated through something that we've never really had to do before. And I think with your help, the city has done a very good job at reaching out and being responsive and adding any kind of amenity we can to get people outside and active and to feel safe. So thank you all for your participation. Make sure you watch the governor's video, and we'll see you on June 10th. Good night, all.